Don't feel like doing anything. I just wanna lay in my bed. Don't feel like picking up my phone, so leave a message at the tone. 'Cause today I swear I'm not doing anything.
Gentle loving hugs, and thanks for turning in to the Fibro Friends radio show here on healthinforadio.com, part of the Entertainment Global Media Network, broadcasting out of heavenly Clearwater, Florida. If you feel like doing nothing at all today, then just sit back or lie down. We're here to educate you with a full spectrum of information on fibro, advocate on the behalf of all Fibro Friends for Fibro Awareness and the need for more research, and support each other with laughter and love. New to fibro? Wonder what it is? Fibromyalgia is a complex chronic disorder involving a malfunction in how the brain processes pain, which leads to other multiple dysfunctions in the body. Some of the main symptoms of fibro are pain and fatigue, sleep disorder, memory and concentration, depression, digestive disorders, hypersensitivity. So today, you've tuned into Fibro Friends. So please welcome your host, Laura Rosa.
Hi, and welcome to Fibro Friends. I am Laura Rosa, and my guest today is Jessie Whitewolf. Say hello, Jessie.
Hello. Good evening. It's good to be with you. Thank you, Laura, for inviting me.
It is my pleasure to have you here. Our topic of the day, we're kind of going to talk about fibromyalgia as an invisible illness. But first, I'd like to get to know a little bit more about Jessie. Jessie, how many years have you suffered with fibromyalgia? Let's go that way.
At this point, it's been 15 years.
Okay. Now, how long would you estimate that you had fibromyalgia, but you didn't have a name for whatever it was you were dealing with?
I don't think anyone had a name for it before maybe around 1999, at least in my experience. And that led to a very unfortunate situation for me, and perhaps for many others. My fibro started when I was rear-ended in a collision. And it did involve a lawsuit, but the suit was based on acute myofasciitis that I was treated for with intensive physical therapy with the idea that eventually it would go away.
And you settled your suit at that level?
I settled my suit, and I have not been able to work.
And not knowing what the future held for you
Exactly.
past that date.
Exactly. So for my share, which was $8,000, I sold my life.
For that one split second in a car crash. And I just want to add here that too is my background. I was T-boned June of 2004. And so that split second of someone not paying attention totally changed my life forever. So I'm your sister here. Okay? So go ahead. Mine was obviously in 2004. My primary doctor was very familiar with the term, so it was a little easier for me. But for you in the 90s, that wasn't so much the case.
Well, at least the supposition was at that time that if you had fibromyalgia, it was a mental disorder, a matter of too much anxiety or a weak constitution that predisposed you to having bodily aches and pains due to stress.
They kind of touched on their guessing with the stress relation, but boy, have they come a long way today. But so you felt like you were being dismissed and giving what I've heard termed a garbage diagnosis, for lack of a better term, at that day and time.
Well, I don't know that I personally felt that way. I was fortunate. I had an excellent physician
That's key.
and a fine specialist. It's just that it was an era where they had not yet discovered fibromyalgia as a legitimate medical illness.
And today there are still those that haven't come to that understanding yet. And all that is, it's due to their lack of education, which is a huge part of why we're here, is to educate and advocate for fibromyalgia. Just plug that real quick in there. So, okay, so were you married, single? How were you coping after the fibromyalgia set in?
At that particular point, I was in sort of a temporary relationship that was conflictual. I had 2 years earlier left a relationship of 23 years.
That's pretty significant.
Yes, and I was in the middle, I was, let's see, at the time I first had the accident and triggered the fibro, I was 50 years old.
Okay.
So it was a major adjustment, and all I had was my own income to rely on, and of course.
So you were working back then, and
Yes, I'm an RN and
a nurse, okay.
Clinical social worker, and at that time I had a.
You're really a support, loving, caring, nurturing person.
Well,
to have those as your background.
Thank you.
You're welcome.
But the unfortunate thing about it was that, as I said, I settled for that lawsuit without any signing off on it. There's never any recourse, which I think that law should be changed. Now, this was in Missouri, and I know that varies from state to state.
Correct.
But I think when people have a condition that is not medically recognized and they later are found to suffer lifelong consequences of that condition once it's known, there should be the ability to go back and say, I signed off on this lawsuit without complete information and knowledge.
Now, I can actually speak for the state of Florida with car crashes. This is my background that I am now disabled from. From my understanding, I am not an attorney. This is not legal advice. But you have 4 years from the date of your crash to make a claim. And if you want to make a claim on your own uninsured motorist, you have 5 years. So sometimes attorneys will grab a case like yours, see it soft tissue. They give it about 6 months to reach maximum medical improvement, and they get a final report and send you out the door with your check if you have a permanent injury, which sounds like was the case for you.
Right.
Right.
But I don't know that anyone knew it would be a permanent injury. I certainly
Correct.
did not.
Is it, I from my research, and I'm not, this is really my research, by running a support group, by working in the legal industry on personal injury, the average client, patient, person develops fibromyalgia approximately 6 months after a car crash. That's my understanding of a typical time range, which is about the time they're ready to finalize you and send you out the door. No, this is not a legal show, but just for those who are interested, because I've been amazed at the number of people in our support group that are there due to their beginnings of a car crash. So that's why I'm throwing this information out there.
Certainly, and I think it is very important if that is so often the case. But just to remind listeners, anything we say here regarding legal matters, do not take us at our word. We are not attorneys. We're only speaking from what information we have been given as lay people. And please check with your attorney.
Thank you for mentioning that. I am a paralegal, I will say, but that still, I'm not an attorney, so that doesn't get me off the hook. But if you need an attorney and you need a reference, we can help you. Let me mention we do have a website, www.fibrofriendsradioshow.com, and we also are on Facebook, which is facebook.com/Fibro Friends Radio Show. Yeah, that's it. So if you want to email, give us a question, point out something we could improve, something you like, please find one of those avenues and say hello. Okay, that's my next plug's done. Go ahead. So here you are. You're unable to work. It gets to a point, if I recall, and you're a nurse. So you went and I would assume filed for disability.
Oh, yes, yes.
Uh,
Um,
how was that for you?
well, the first time I was turned down, so of course, actually, I used the same attorney as I did for the accident case.
Good.
And because.
And you're in Missouri, right?
Yes.
As you say it, Missouri. Did I say that right? You say you're true Missourian?
That's true. I do say Missouri, and
one of my best friends
people
is
make
from
fun
Missouri.
of me, but
No,
that's
I'm
true.
not making fun
That's
of you.
how the locals say it.
Yep, I love it. Anyway, so here you are, jobless, applying for SSDI. Not yet.
SSD.
Oh, Social Security Disability,
Right.
and the I is Social Security Disability Income today.
Okay.
Same thing. We're the same thing. So I also had to leave my work, and it took me 4.5 years. Even in this, I would say I was about 6 or 7 years after you, because fibromyalgia again was not understood, and I believe what really did it for me wasn't the fibro, it was all the other symptoms that fibro can bring on that actually, the aches and pains. I had all these surgeries from my car crash, but that wasn't enough to consider me to be disabled. I was disabled because I had a severe sleep disorder. So therefore, driving to work, I wasn't, every morning I woke up, I didn't know if I would have been enough rest to even drive. That's a day-to-day deal. And I had a very high energy, high level job that if I was not at my peak, it could affect my boss's career significantly. So I had a lot of what I learned later to be called fibro fog. So I thought, geez, do I quit or go for disability, or I just wait till they fire me for lack of production? Because I was so afraid of, I was sharing my story here with you as we go along. Single mother of 4 children and the sole breadwinner. And I made it through all those surgeries until the sleep disorder just put me on my back.
Right.
So I totally am getting where you're coming from.
Well,
It's
and we know
very, very frustrating.
Sure, and we know there's now a close association between a little bit of fibro fog here.
Good. I'm not the only one in the room.
Chronic fatigue
syndrome,
fibromyalgia, sleep apnea.
Or any sleep disorder, really. I believe we had our very first show we did here. We had an expert. His name is Dr. Gene Martin, and he labels 6 major disorders that fall under fibro. He can generally find all 6. Now, this isn't the AMA guidelines, but this man has devoted his life to it. And if I'll get 5 of them maybe, but sleep disorder, depression, pain, widespread pain, fatigue, mental impairment. Maybe I'll end up with too many. And I don't want to say IBS, but I think it was worded like, digestive disorder.
Right.
So we all, if you really look down, will find that those 6 areas, if you have fibromyalgia, you're going to have all 6 of those at some level, maybe just a little bit. And I also want to categorize, we have functioning fibros, and then we have disabled fibros. So we're not the same that way either.
Well,
the level of how much we're affected by the disorder.
well, and I'd also like to say, at least in my experience, the fibro has periods of exacerbation, which means that it intensifies and gets worse. And it has other times where it sort of mellows out and really doesn't bother you quite so much, at least for some of us. And that's been my experience. The difficult part of that is that I can go from feeling pretty good and getting about and doing my usual
Great
stuff.
now, you're healthy. What
Right now, I'm
I
feeling
wouldn't have
good.
a clue. I would not have a clue that you
But,
had a debilitating chronic illness.
Yeah, I mean, and that's when in the beginning, and actually for quite a few years, you get the impression when things are settled down that you're okay. Like maybe you're going to be all right. And then all of a sudden, out of nowhere, you get slammed with this widespread pain, which, from my own experience, is it's like a deep, smoldering burn that starts from my neck, goes all the way down my back. It goes all the way across my shoulders, all the way down the sides of my back and across my hips. And if it gets bad enough, it goes around my rib cage.
Wow. Yeah.
And what it feels like to live with, it's pretty severe pain. What it feels like to live with it, which I'm sure many of our listeners know, it's like having a sandbag strapped around your neck, another one around your waist, and another one around your hips. And imagine living with them. Every move you make, they are there.
And they have sand spurs all over them.
And they never, ever, ever completely go away.
Regardless of what you're doing.
And you never know when they're coming. So you go from, for a long time, you go from thinking, oh, gee, I think I'm going to be all right, to, I hope my life doesn't last too terribly long. It's that bad. It completely.
Now, would you say that's due to the depression caused by, if we had depression before, it's amplified now, and I understand biologically it creates depression on its own.
Yeah.
And so you're saying, let me let you finish.
Yeah.
Go ahead.
I would say I've always had periods of depression. And I can tell the difference between the depression and the, when I'm talking about, I hope, that I don't continue to live for a long, long time. I'm not talking about such despair that I want to die right then. I have plans and goals and things I'd like to be doing, things I care about. I haven't lost interest in life. I haven't lost interest in relationships. It's just that I am so miserable that another 20 or 30 years, if you can imagine being in prison with those sandbags wrapped around you.
Mm-hmm.
Okay, I mean, they aren't ever going to go away. And I'm not trying to depress everyone. I don't even look at it that way. I think, gee, if I get another 5 or 10 years and I can accomplish some of the things that I want to do to sort of wrap things up, I'd be perfectly happy. I don't need to be 90 years old and feeling like this. It's bad enough now.
That makes sense. Now, just for the listeners out there, there's a lot of people out there that do believe there's people curing fibro. And I've done some research, and I'm not going to give an opinion on that right now, because I I feel like taking a side on that is cutting out people either way I go. But I do know that we are finally in a place where we actually have it's been there for a few years, a medical ID code, where they have and Social Security disability has finally put us in a category. And there's more and more people jumping in and learning about, advocating for. So I believe when we get the attention that it deserves, there's going to be, it's kind of like, remember breast cancer was like just like any other cancer, and now everything's pink everywhere you go. And the reason I think that it's going to be significantly similar to the breast cancer awareness is it varies from place to place on statistics, but it's approximately 8% of the population suffer with fibro, and a lot of them don't know why they're suffering. And a good chunk of those are men because they feel they need to be stoic and just suck it up and get the job done. There are things out there now that are giving us relief. There's some protocols out there to follow that can take you from somebody who may be non-functioning fibro to a functioning fibro. I can say comfortably, I know there's been some success with some different lifestyle changes. So, but I see what you're saying. You've had it for so long, you probably don't remember what life was like before, or maybe you do.
Well, I think I'm also at the age, I'm 65, where
I wouldn't have guessed.
it's a good time to reflect on life.
Yes, it is.
And one of the things I refuse to let my fibro steal from me is my imagination and the pleasure of my memories.
Fantastic. That's really great attitude.
Right. Well, I appreciate you saying that. It's
Makes a big difference.
Good for me. So
yes.
Perhaps it might be good for others too.
I'm certain it is. As I see, all these little quotes everywhere, but attitude is everything. And whatever you focus on gets bigger. And if you're stuck in that wicked wheel of negative thinking, oh, my life is over, you're gonna miss those opportunities that come by. They do.
That's true, but you also need to allow yourself to have the grief of the loss you experience, and you were asking earlier about depression. I find the most depressing thing is the ups and downs of it. The getting your hopes up and then having a really severe episode, and these episodes, the slightest thing. About a month ago, I have to have someone come and clean for me and eke out their fee from my Social Security check, because I just can't do that anymore. I know that if I try to clean the house or even parts of it, bending over is extremely difficult to stay bended over for any amount of time, that I'm going to pay a great big price in pain and inability to function and fatigue for sometimes weeks and sometimes months.
Yep. By just a small push too far over the edge of your limitations.
Sure.
Right?
But the this particular instance, I picked up things that were lying around so the fellow could clean, and just that was enough. For the next 3 weeks I was immobile, and then the doctor gave me some medicine that I requested that I thought just maybe might help. And despite some concerns about potential side effects, the doctor agreed, and I did use this medication, and I felt much better.
Do you mind sharing what that is? That's fine.
I don't think I should, because it's not an approved it's not specifically
Approved
approved,
for fibromyalgia.
and I don't want to be dispensing medical advice, but
That's
I
fair
will
enough.
say that I did ask to stay on it, and I think that when we confer with our doctors, and for any doctors out there that might be listening, we're talking about something that's not going to go away. It's going to get better and worse. You'll have your ups and downs, but it's not going to go away. And the best we can do right now is try to control the symptoms.
Mm-hmm.
So I would say, at least at this point, after 3 weeks of being on this particular medication, which is not a specific fibromyalgia med, it's something that's generally used for a lot of different things.
Okay.
But my life, at least right now, feels like it's gone from an endurable existence to actually having a life.
That's a big change.
So
So
anytime.
just the past 3 weeks, you're saying you feel like you're regaining your life, and I'm gonna only guess you're in the back of your mind. You're thinking, how long is this gonna last?
Right. Are side effects going to kick in that make it
could-
impossible?
Right, and we are more susceptible to side effects than the average healthy person.
Right.
It's gonna happen. It'll happen to us.
But the thing is that hopefully doctors will. The other thing is, I think they really need to listen to what their patients are telling them. I mean, I know, and probably this is true for just about anyone with this condition, that if I'm underwater in a pool,
Mhm.
the pain goes away until I get out. So the obvious thing is to find a way to release gravity. And
You're absolutely right about that.
you know,
Water is excellent for us.
right. But NASA needs to get in there and do some research and invent something we can wear that will give us that anti-gravity effects.
You know, we just had a gentleman join our group who worked for NASA. You haven't met him because, you haven't crossed paths. We need to see what he can come up with. But that would, yes, just the weight on our muscles and our joints and everything being inflamed. Even our eyes can get inflamed, and our vision changes throughout the day. And that plays havoc if you have prescription glasses, because they're not the correct prescription most of the time until you're at that same spot you were when you had your eye exam. Let me just real quick say that if you'd like to call in and jump in on this discussion, our call-in number is 727, what is that number? 493-2055. So feel free to call in. Again, it's 727-493-2055. Okay, so I met you through our support group. You came in and you shared a little bit about yourself there, and you live pretty far away from our support group. So for those of you listening in the Tampa Bay area, there was a fibromyalgia support group in Pinellas County that folded, and Jesse and I are going to be creating one in this area. So anybody who is interested in learning more about that, you can, like I said before, catch us on our website, which is www.fibrofriendsradioshow.com, or Facebook, same, facebook.com/fibrofriendsradioshow. So we may have the group on Monday afternoons just before our regular show, so that we can bring guests in through there. I know we're going to take a break here for a little while, and we'll be back talking with Jesse. And so stay tuned. We'll see you in a moment. Thanks. Hi, and welcome back to Fibro Friends on Health Info Radio. I get those two words backwards. And we're talking today with Jessie, who is a longtime fibromyalgia sufferer. She's been sharing her story about living with fibromyalgia since the early 1990s and the ups and downs that she's had to live with. Again, if you want to call into the show, at the number is 727-493-2055. So I'm going to take where you left off and like our topic of the day, as we have a tip of the day. We have a couple things we do. Fibromyalgia being an invisible illness. How much that can actually cause us more problems than somebody who is visibly disabled.
Well,
What's your comment on that?
Okay. Thank you, Laura. I think the thing about it being invisible is that people don't realize that you have a chronic illness and that's debilitating. The pain can be quite severe and interfere with your movement, interfere with your ability to pay attention to anything else. And it's very difficult not to maintain some sort of a grimace or a miserable expression. It's very difficult sometimes to pay attention to what people are saying. And people don't always know what to make of that. They can see something's wrong, but they don't really know what. Or else they can't see it, and you're just experiencing it. And it changes the whole situation that you're in all the time. I, as a person that lived alone, really felt the need to tell people what was happening to me. First of all, it was very frightening. And to not be able to, I personally needed someone to acknowledge and understand what I was going through, even though I knew they couldn't fix it. That wasn't my expectation. It was just being so alone with something.
And finding the right words. How do you tell somebody,
Well,
to make them understand how complex this disorder is?
well, that's it. I mean, you wind up saying, "Oh, my back hurts so bad," or and then you just sound like what they call a chronic complainer. And
That's one word I've heard.
heaven forbid, I feel sorry for the chronic complainers that have lived for centuries with this particular illness, because it's simply sometimes a matter of trying to get people to understand that you're not in a happy mood, or you're always late, or you don't get
Guilty.
someplace and you don't want to commit to anything, because you never know what your body is going to expect from you. And you really literally learn to live with what your body tells you can do, moment to moment, day by day. And there's really nothing else you can do about it except try to take care of yourself the
Right.
best way you can. Follow your doctor's instructions. Ask questions. Tell your doctor what you're experiencing. And hopefully there's somebody that you can reach out to that understands. I went to the Fibro group in Tampa that Laura runs, hosts, and only one time. But I was so impressed with the people there and their empathy and their sharing of being saying, "Oh yes, me too, me too." I felt like I had finally found a home. But the 30-mile drive,
Yes,
um,
it's a lot.
both in terms of fatigue and sometimes residual pain, that means pain that continues to last. Um, those two things, and the fact that I have next to no income, and the
Yes.
price of gas have really made it impossible for me to go back. But and generally, it's my habit to just sort of move on to something else when I encounter those kinds of obstacles, and in getting into a group or staying with a group. But this one I couldn't. I just had to keep in contact, and
As you
now
have, yes, and I was so thrilled that you did. We have a little note. We do get several members that join, and they're just kind of hang out there. They don't even. I'm able to see how often they visit, and they sign up, and then 6 months have gone by, and they've never come back to even the website. So we send them a nice little note saying, "It's some other time you feel that we could be of help. Please come join us again." And so basically, it says if you go more than 3 months without interacting, we will remove you from the list. And you sent me a note saying that it just wasn't going to be possible. And I said, well, I'm not going to remove you from the list, so at least you can keep up with what we're doing. And now we've come to a place where we might be able to create one in your area closer for those out there listening.
I'm really excited about the idea of having our fibro support group here in Pinellas County.
Yeah, we're Tampa Fibro Friends there, and this one can be whatever Fibro Friends, Pinellas County, Clearwater, whatever. So it's it'll be so easy to duplicate what I've done, and from the way I understand, I started it on Meetup.com, which is the national site for anybody who wants to just start up their own group for anything. It goes from art, swimming, crafts to support groups. It's I don't know, it probably has more than 100,000, meetup groups throughout the nation. It's huge, huge site. So, but I was amazed when I went to Meetup.com and I typed in fibromyalgia and it said like there was a number like 250 people have checked off that is of interest and they're waiting for a group. So I thought, well, gosh, we've never, excuse me, done any advertising for our group yet. We continue to grow and grow and grow. People come, people go, but
Mm-hmm.
whatever they get out of it. I'm just grateful that we can be there. It's helped me more than um, I put into it for sure. I mean, I created it for the same reason. I needed to be around other people because it's an invisible disease and I may bump into somebody at the grocery store and I've got my makeup on and they assume whatever was my problem last month that I'm fine. They
Mm-hmm.
do not understand this is a chronic illness. So, um, even when we use our handicap parking spots, sometimes I feel like we're
Mm-hmm.
getting the look of, I doubt you really need that handicap spot. Little do they know
Sure.
what's going on and how I cope with pain. I can hide it really well on my face for a certain period of time, and then I just have to run and crawl in my bed and just take off all my clothes. I mean, everything hurts. Just
Everything hurts, yes.
it's it's horrible. So I actually went to we have a once a year a really excellent nonprofit group called the Family Cafe, and they come to Orlando, and it's free for anybody with a disability. And they have speakers from Medicaid, Medicare, kids' school issues, everything and anything with people with disabilities can gain by going to this group. And for the life of me, I cannot remember why my point was talking about that. There is a point with that, but at least it's always in the summertime, and we had a group of our inside our support group that did go, and we're learning new things all the time. But I'm huge into advocacy, and oh, I remember. Sorry, they give you there's free wheelchairs and this, that, and the other. And my health conditions, as to reiterate what we've said in the past, all of us have fibromyalgia, but we all have the basic underlying issues, yet we have our own set of issues. So not one of us is identical. We cannot all be treated the same way.
Right.
So, and I'm with my daughter, and I it's this huge hotel, and I can't walk very far, and I felt they're like, well, here's these kids who look definitely disabled, no question. And just even getting the hotel to get our luggage, they put us like at the back of the place on the third floor with stairs, nowhere near the elevators. To the fact I couldn't even go one day to the conference room. I was so exhausted. And here I am at a facility supporting disability, but because people can't see it, they can't appreciate how significantly painful that, or I'm in pain, even if I tell them, I'm just feel like it comes across as a whiner and a complainer trying to get my way. So anyway,
Mm-hmm.
um, sometimes I feel like we just need a flag on us. It said, I have
I have
fibromyalgia and I'm in
fibromyalgia.
pain.
Right.
Don't come too close, I bite, something
Ex-
like that.
well, we don't bite, but
It depends on how bad off you are that day. I have never
that's true.
bit. Just a little humor there. But
Yeah, as far as we know, it doesn't affect the teeth.
no, actually, it's funny you
Or
say
does
that.
it?
Um, After a couple of years of having fibromyalgia, I had my teeth break off.
Really?
Now, yeah. Now, is that due to vitamin D deficiency? Is it due the medications? The doctors didn't know, but
Mm.
boy, was I embarrassed to smile for a few months till I could come up with the money to get them fixed.
They're beautiful.
So Yeah, thank you very much. I can't think of any part of my body that's not affected by fibromyalgia, which
Yeah.
brings me to physicians. And I have several specialists that I see, and I generally ask them politely, what is their knowledge or understanding of fibromyalgia? And the general response is, well, that's not my specialty. And of course, I drop it there. Maybe I need to get a little more uh, um, stronger about that because it's unacceptable. Even though they're specialists, we have fibromyalgia and we need different kind of treatment and understanding than the non-fibromyalgia people.
Well, the two groups of physicians that I know of that deal specifically
Mhm.
with fibromyalgia are rheumatologist
Right?
and,
Neurologists are one.
well, neurologist to some degree, perhaps. There's
It's
another one.
okay.
Pain specialist,
Yes, pain management.
pain management.
Now, what I've learned from Dr. Martin, who is our expert, is um, rheumatologists. I guess this was his explanation back in the day when people were picking their specialties. Rheumatology wasn't really a big one to go into because it's very specialized into people who have muscle and joint disorders. It's pretty much what they do. Rheumatoid arthritis would be an example. But now they've learned that fibromyalgia is a neurological disorder, and it has
Hmm.
to do with the sheathing around the spinal cord that wraps around into the brain, and that more and more neurologists are now becoming the doctor of choice. This is my understanding. I see you over there going, oh, I'm not familiar about this. Um, but Dr. Martin said that once the fibromyalgia came out with the name, they started just getting overloaded with patients, and they don't want to let that go. But they're only able to help half of our problem because my understanding
The
of
rheumatologist?
yes, he's helping
Okay.
with the muscles and joints, where the neurological part of it is from again
Okay,
we
go
haven't
ahead. Go
talked
ahead.
before about this, so
Yes, yes, go
and
ahead.
your opinion is totally open. But the way I understand it, we are constantly living in the flight or fight, the autonomic nervous system. And the key is to calm that down so that the nerves stop firing. And of course, we get into adrenal fatigue because of the overload. And it's just like the nerves are just constantly firing and firing, firing. So, he says no caffeine, you know, try, all these different options for relaxation, meditation, learning biofeedback. And if you can live in a stress free world, which is really not possible the way our society is, you will see a significant decrease in your pain level. Now, you're raising an eyebrow, and so I want to hear your point of view.
Well, it's not so much point of view, it's a matter of differences in information. And
Correct.
I think you are much more current on what the latest thing is. So I'm not disputing you when you say it's a neurological disease. I guess the only point I want to make is in terms of rheumatologist, there's a whole array of illnesses that fall under that specialty. There's a specific group called collagen's diseases, which have to do with connective tissue illness.
Yes.
And things like rheumatoid arthritis and lupus, systemic lupus, and a number of scleroderma
Mm-hmm.
all fall into that category. And I did see an article on the internet
Mm-hmm.
that said there was a group that was studying fibromyalgia as possibly belonging to that group of illnesses.
Those are autoimmune disorders.
Yes, they are, but they all affect the connective tissues.
Yes, they do.
And that's where the rheumatologist comes in.
Yes, and from what I understand is, although we mimic an autoimmune disorder, it's not an autoimmune disorder. Now, I don't know the difference, but it doesn't meet the criteria scientifically. But it looks like one. What do they say? If it looks like one and feels like one, then it must be one. But that's not the case. And I'm
Okay.
also aware they now have 2 different tests where they can actually, I think one is like taking some spinal fluid, and they can test for fibromyalgia. That's now being documented. They're only using it at the research level. It hasn't filtered down to our doctors getting a hold of using it, but they're finding the accuracy of it is significantly high.
Do you know what they're finding in the spinal fluid?
Nope. But then again, this is a free-flowing talk show here. We discussed it in our group last meeting, and they were more informed about it. And the articles, I will pull that research up and get it out here, because I think people need to at least know that it's
Okay.
we can prove it now.
Is it available on the web?
The information is out there.
Do you know where people can find it?
Nope. But I will. How's that
Okay.
for a dangler to leave you till the next week? We just have
I'd be very interested.
couple minutes left on our show. It really flew by today. I think we could discuss fibromyalgia another hour, and you are welcome to come back. I just want to say that.
Thank you.
I want to first say that we're new to this radio station, and they had their Emmy Awards last night. They do it yearly. They have several shows, many shows. Health Info Radio is one segment of a bigger parent company. And our show got the award of Best New Show with Health Info Radio. And I'm really proud that we earned that, seeing that we only have one show under our belt. And let's see here. I'm trying to keep our show in a bit of a format. And I always like to leave with a tip of the day. And my tip of the day, this is my research I was going to talk about, which has to do with, there we go. The tip of the week is the real way for people with fibro to prevent bone loss is exercise and a proper diet of fresh vegetables which contain much calcium. Fibro people have a harder time as calcium loss is related to adrenals, which are related to the fibro. So tip of the day is keep exercising and eat a lot of fresh fruits and vegetables so we don't end up with osteopenia, then osteoporosis. And it's always good to get a bone density test if you haven't had one to see where you are at. Any final words from you that you can think of, Jesse?
Well, I'd like to thank you for inviting me to join you.
It's been my pleasure. You have done a tremendous help. So I will be coming back with information on what tests are. That'll be my research for next week. And we were going to add It's My Life segment to the show today. But the boards for graphing are not quite finished. So I want to say goodbye. Thank you for joining us, and we look forward to seeing you same time next week.
Fibromyalgia can strike any person at any age. If you feel that you may be suffering from fibromyalgia, please contact your medical provider as soon as possible for proper diagnosis and a treatment plan that works for you. We are not a replacement for professional medical advice, but we are your Fibro Friends for advocacy and education and support. We encourage you to share via email, Facebook, or Twitter through a link from any of our shows that can be found on our website at fibrofriendsradioshow.com and on Facebook at Fibro Friends Radio Show, with your doctor's support system of friends and family and your fellow Fibro friends. Remember, laughter is still the best medicine, so share the Fibro funny today and keep a smile on your face and in your heart. So pass this Fibro Friends smiling, gentle hug full of love to someone in pain today, because it's always the love that heals.